What really separates a good nurse from a great one isn't just about the tasks they do, it's all about how they think. Today, we're going to break down the single most important mental framework a nurse uses to make safe, often life-saving decisions. It's basically a 5-step blueprint for critical judgment, and it's called the nursing process.
So picture this. You're on your shift, you walk into your patient's room, and bam, you spot something that was not there this morning, a new, painful-looking wound. Your gut might be screaming, do something, fix it. But what is the correct very next move?
Well, the answer isn't just, grabbing a bandage or immediately calling the doctor. Your first, most critical action is actually to start thinking like a nurse, to fire up this mental blueprint that guides you from spotting the problem to figuring out the absolute best solution.
Okay, let's put this blueprint to the test with a real-world scenario. Let's meet Mr. J. He's 78 years old, he's recovering from a hip fracture, and he's completely bedbound. Our clock starts right now.
So this blueprint, it's a 5-step cycle, and we use the acronym ADP to remember it. It all starts with assessment. That's gathering your clues. Then diagnosis, naming the problem, followed by planning, implementation, and finally, the big one for today, evaluation, judging if our plan actually worked. Let's just quickly run through the first 4 steps to see how they set the stage for that crucial final verdict. So our assessment of Mr. J begins. First, we gather subjective data. That's what the patient tells you. In this case, my backside hurts, it's burning. Then we get our objective data. This is what we can actually see and measure. We see a 4 by 3 centimeter red, shallow ulcer, and we identify it as a stage 2 pressure injury. These are the cold, hard facts. All right, with our facts gathered, we can now form a super precise nursing diagnosis. Now, this isn't just a medical condition. It's a complete sentence that tells a whole story. The problem is impaired skin integrity. The cause? It's related to immobility. And the proof is as evidenced by the wound we saw and what he told us. Problem, cause, evidence. Simple as that. Next up is the plan. Look, we can't just hope for the best. We need real, concrete targets. We set SMART goals. For Mr. J, our first goal is specific and it's time-bound. Let's get that wound size down within 7 days. And our second goal is all about prevention. Let's make sure no new skin breakdown happens. These aren't just vague hopes. They are measurable benchmarks for success. So, we've assessed, we've diagnosed, and we've planned. We've been implementing our interventions, turning Mr. J, applying new dressings. A week goes by, and now comes the most important step of all, evaluation. It is time to ask the big question. Did any of it actually work?
Now here is an absolutely crucial point. Evaluation uses the exact same skills as assessment, but the whole purpose is different. We're not hunting for a new problem anymore. We're judging our progress against the goals we already set. So we remeasure the wound. Hey, it's smaller. We reinspect the tissue. It looks healthier, pinker. We check in with Mr. J, and he tells us it hurts less. This is our verdict data.
Okay, now we bring it all together. We lay our goals right next to our new findings. Our goal was to get that wound down to 3 by 2 centimeters. We actually beat that, so that goal is met. Our other goal was to prevent more breakdown, and the skin is totally intact. That goal is also met. The data doesn't lie. Because both of our outcomes were met, our clinical judgment is pretty simple. The plan is working, so we continue the plan of care. And this is key. Met doesn't mean finished. It means this is effective, keep going until the problem is completely solved. But what if that wasn't the outcome? I mean, what if after those 7 days, things weren't better, but way, way worse? This is where a nurse's critical thinking is really, truly put to the test. So let's hit rewind and imagine a different reality. Instead of healing, the wound has actually gotten bigger, and now it's got some unhealthy tissue in it. Mr. J tells you his pain is worse. In this scenario, the verdict is just as clear, but it's the total opposite. Outcome, unmet.
So, you've just determined the plan is failing miserably. The wound is worse. What is your absolute priority action at this exact moment?
The answer is not to just panic and randomly try something new. The priority is to enter what we call the revision loop. First, you state the obvious judgment, outcome unmet. But then, and this is so critical, you have to stop and reassess. You have to figure out why it failed before you can ever hope to effectively revise that plan. So, back in our alternate reality, our reassessment uncovers two brand new problems. Turns were being missed on the night shift, and Mr. J just isn't eating enough. This is our why. So now we can revise the plan to target those root causes. We'll get him a special pressure-reducing mattress and start some protein supplements. We even revise the goal itself to be more realistic, shifting from healing to simply stabilization. What happened to Mr. J in our failed scenario isn't just a hypothetical. When this evaluation and revision process breaks down in the real world, the consequences are enormous for the patient, for the nurse, and for the entire healthcare system.
This brings us to a really critical concept called never events. And they're exactly what they sound like. Serious, mostly preventable errors that are considered so unacceptable, they should just never happen. So why do they call them never events? Well, look at this number. That is exactly how much money a major insurer like Medicare will pay a hospital to treat a pressure injury that developed during the patient's stay. Zero. Nothing. It's considered a preventable failure, and the hospital just has to eat the entire cost. And it's not just about pressure injuries. The list of never events includes things like patient falls, certain hospital-acquired infections, even horrible surgical mistakes. This makes the nursing process, and especially that evaluation and revision loop, a critical tool for both patient safety and the hospital's financial health. Okay. We've covered a lot of ground. Let's boil it all down to the absolute high-yield takeaways. These are the core concepts you have to lock in, especially if you're studying for an exam like the NCLEX. All right, here's the final breakdown. First, know the difference. Assessment finds the problem. Evaluation judges the solution. Got it? Second, and this is huge, if a plan fails, your absolute priority is to stop and reassess why before you revise. Third, remember that never events are the expensive, real-world consequences of failing this process. And finally, a core principle. If a goal is unrealistic, you modify the plan to fit the patient, never the other way around. So the nursing process is a powerful blueprint for reacting to problems once they pop up. But the final challenge, the thing I want to leave you with, is to take it one step further. How can you use this same structured thinking, assess, diagnose, plan, not just to react, but to actually predict? How can you use it to stop a problem before it ever has the chance to become a never event?